The creation of an important new resource for this community, and that is the Monroe County Sexual Assault Response Team, or SART. This is something that we believe will result in an improved coordination of existing resources in our community in response to a sexual assault incident and greater sensitivity to the needs of sexual assault victims. It will also enhance our ability to provide forensic medical examinations at the Bloomington Hospital for sexual assault victims. And finally, it will result in better evidence that can be used in the prosecution of sexual assault crimes and hence better results in those cases. My office issued the call for a SART and organized the first meeting in October of 2007. The first thing we did was to conduct a stakeholder survey to identify the resources that already exist in our community and to try and bring everyone to the table so that we could assess what we needed to do to improve our response. We clearly identified the number one need to be special training for nurses to provide sexual assault forensic medical examinations at the hospital emergency department on a 24-hour-a-day, 7-day-a-week basis. So to make that happen, we engaged in fundraising efforts, writing grants to help Bloomington Hospital create a new sexual assault nurse examiner program. My office submitted several grant proposals, and so far we've raised $27,000 from the Bloomington Hospital Foundation, the County Council Social Service Fund, the County Council General Fund, and from the Office of Bloomington Mayor Mark Cruzan. So I would like to especially thank those funders and supporters of this, especially thank former County Council member Sophia Travis for her consistent sponsorship of those efforts, and acknowledge Jeff McKim from the County Council, who is here with us today. And I would also like to specifically thank the Bloomington Hospital Foundation, whose support for this effort was pivotal in making it happen, which is a real service to this community. I'd like to give special recognition to some representatives from Bloomington Hospital who are here with us today, and that is Debbie Lemon, who's the chair of the Bloomington Hospital Foundation Board, Chris Malloy, who's the president of that board, Mark Moore, who is the president and CEO of Bloomington Hospital, and Ruth Ann Morris, who is the vice president for patient care services at Bloomington Hospital. With the funding that we were able to secure, the hospital was able to move forward and train an initial group of nurses to become sexual assault nurse examiners, or SANE nurses. Today we are ready to announce the creation of the SANE program at Bloomington Hospital, and this new community resource is the heart of the sexual assault response team. These nurses are trained to provide comprehensive care to sexual assault victims and to conduct these forensic medical examinations, which include collecting and preserving evidence related to sexual assault that can then be used in legal proceedings. The Department of Justice Office for Victims of Crime has long recognized that SANE programs have made a profound difference in the quality of care provided to sexual assault victims. And I have been aware for some time that Monroe County has been behind the curve on this issue. When I meet with other prosecutors from other jurisdictions around the country at conferences, and I ask them about what their experience has been with SANE programs in their communities, many of them just kind of shake their heads and say, well, we've had that for a long time. So this is not just a best practice, this has become really a standard practice, and they would often then look at my conference name tag and see where I was from, and they'd say, Bloomington, Indiana. Don't you have a major university there? And they were surprised that a community like Bloomington with a major university didn't have this resource of a sexual assault nurse examiner program in the community. Because this is exactly the type of community that needs it most. All the data shows that young women on college campuses are at the greatest risk for experiencing sexual assault. So we are very pleased to have with us today Mary Hoskins, who's the clinical director of the emergency department at the Bloomington Hospital, to publicly announce the creation of their SANE program. That will be an incredible new resource for this whole community, including students on the IU campus. From now on, when a sexual assault incident occurs in this community, the Monroe County Sexual Assault Response Team will be available to provide services to victims. Today, we release the written protocol that was drafted and adopted by all of the stakeholder organizations who've been involved with the Sart. This is the document that will guide the response to sexual assault incidents in our community now. And that document is available in press packets for anyone in the media who's here. It'll also be up on our website later on today. According to that protocol, the response will include a trained sexual assault nurse examiner or SANE nurse, a victim advocate, and a law enforcement officer. Now, as I mentioned, the SANE nurse is the heart of this response team. Mary Hoskins will be up here in a minute to tell us more about the importance of their work. The victim advocate will also be available at the victim's option for support, to answer questions, and to inform the victim of their rights and to explain what to expect in this whole process. Toby Strout, the executive director from Middleway House, is here with us today to talk about the role of the victim advocate in this new protocol. And under the new protocol, the victim will be empowered to guide the initial response of law enforcement. If the victim chooses to report the sexual assault to law enforcement, then there will be an immediate criminal investigation. Also, under this protocol, a victim who is at least 18 years of age may now choose to obtain a free forensic medical examination at the hospital and request that the incident not be reported to law enforcement. Our goal is to encourage victims of sexual assault to immediately obtain this free forensic medical examination to ensure that the best physical evidence is collected and preserved, regardless of whether or not the victim wants to report the incident to law enforcement. The victim does not have to make that decision immediately. They can take time. They can think about it. They can talk to family members, friends, counselors. If the victim goes to the hospital and gets the rape exam and chooses not to report the incident to law enforcement, then the physical evidence will be collected by law enforcement and stored anonymously under a confidential number for the period of 1 year. Again, we want to encourage victims to get the rape exam without worrying about losing control over the situation. We want to preserve the physical evidence and keep the door open for a successful prosecution if the victim later decides to come forward and report the crime within that year. The victim is empowered to choose. We're also publicly releasing a new brochure. We have several copies up here that's intended to explain the Monroe County Sart both to sexual assault victims and to the community in general, to make everyone aware of this new resource. It's in a simple question and answer format with topics such as, what is sexual assault? What is the sexual assault response team? The choice is yours. Who is there to help me? What can I expect? And what should I do if I've been sexually assaulted? We want to get the word out and encourage victims to go to the hospital and get a free rape exam and know who to call for help. The brochure encourages victims to report sexual assault immediately so that there can be an immediate criminal investigation, but it also empowers the victim with a choice and gives them the time to decide later if they need it. We're also here to announce a free training for law enforcement and other stakeholder organizations who are involved in the Sart to explain the new protocol and what it means, and to get the word out to our various organizations about how we're going to work together now, how we're going to continue to improve our practices, and the schedule for that training is in the press packets. It's scheduled for September 22nd. We have Captain Joe Qualters from the Bloomington Police Department representing law enforcement here today to talk about law enforcement's role in the protocol. We also have several representatives from Indiana University present. We are honored to have Karen Hansen, the provost of Indiana University, Bloomington, here with us today. Thank you for your support and your participation in these efforts and making this happen. We also have Carol McCord, the Associate Dean from the Office of the Dean of Students, Debbie Malone from the IU Sexual Assault Crisis Services, and I'll invite them up to make some comments here in just a minute. I want to acknowledge support also from the Office for Women's Affairs, Dean Yvette Asenso, the IU Health Center, the IUPD, the IU Drug and Alcohol Information Center. Dee Owens is here today with us from that organization. So this is a broad coalition that includes both the community and the campus. In this protocol, Indiana University has pledged to work with the Sexual Assault Response Team to promote education aimed at preventing sexual assault and to create an awareness about the link between sexual assault and alcohol consumption. We all agree on this, that education and prevention are key. We don't just want to react to sexual assault. We want to stop it from happening in the first place and stop people from experiencing the victimization, the trauma of victimization. We want students to understand the issue of consent, and that's the message that 15 different organizations have gotten behind with this poster that you see before you today. We want students to know that sex without consent is a crime. We want students to have an idea of what consent is and what consent is not. Consent is based on choice. Consent is active, not passive. Consent is giving permission without feeling pressured. Silence, passed out, intoxicated, fear, those things are not consent. Only yes means yes. The line of falling dominoes that you see on this poster that makes out the S in the word sex represents a chain of events. That's what we always hear. One thing led to another. And at the very end of that chain, that last domino is saying, got consent? Ask. Now that's a simple message, but it can avoid a whole lot of trouble for everyone, for the victim, for the defendant in a criminal case, and for the sense of safety and security in our community and on campus. There's a person sitting at that top domino at the beginning of that chain thinking, caught between the past and the future in this chain of events, one domino falling on another. And the poster reads, "You can't change the past, only the future." These posters are going to go up all over campus and the community starting right now. We have volunteers here to help us spread the word, including a new organization of men addressing this issue called Man Up. We also have campus peer educators for healthy relationships, Savant, who are here, and others who are going to be helping us put up these posters. Together, we are going to change the future and build a safer campus and community. So thank you for your attention, and I'd like to now invite Bloomington Campus Provost Karen Hansen up here to say a few words. Thank you.
Thanks, Chris. We are very grateful to the Office of the Prosecutor and all of the organizations in the community on the campus who participated in this wonderful initiative. This is very important for our students, for the community as a whole, and it's as the 40,000 students return to campus now, it's an educational mission which is crucial to their well-being. And the partnership that has been displayed between all of these offices in the county, in the city, and on the campus is key to the success of this initiative. We will be taking very seriously the educational part of the mission as well as the response part of the mission. We're ramping up our efforts to make plain to all students the connection, as Chris noted, between alcohol consumption and sexual assault. And we're ramping up the mission to remind all students that only consent is consent. I am grateful to all of the people who've been involved in this from the campus and the community, and we're very hopeful that this will be a start to a much better year for all of our students and for the community, a new decade. Thank you.
Mary Hoskins from Bloomington Hospital.
Thank you for this opportunity. Bloomington Hospital has been honored to participate in this community-wide initiative. We are as we constantly try to serve our community better, sexual assault nurse examiners is a piece of that. Our program of dedicated nurses, passionate nurses, very interested in this modality of service, have volunteered for this effort. It's 3 months of training. They dedicate their lives to that. It has been life-altering for them, and how much meaning there is behind the quality of service provided to sexual assault victims. They have come and spoken to me after this opportunity and said that they did not understand the depth until they actually performed these services as a certified nurse. It has grown tremendously. I have a backlog of 12 individuals who want to become sexual assault nurse examiners. So we will be very prepared in the future. 2010, 24 hours a day, 7 days a week, a qualified, sane nurse there to assist our patients, our sexual assault victims. Again, it's been a community-wide effort, and it's our privilege to participate.
Again, thank you very much to Bloomington Hospital. Carol McCord from the Office of the Dean of Students.
Thank you. I want to thank Chris for taking the leadership to make this happen, to bring all of us together to be able to work on creating this improved structure of support for victims of sexual assault, and hopefully for also getting the word out in our community that this is an unacceptable activity. On campus, we know that the numbers statistically are that 1 in 4 to 1 in 6 young women can be sexually assaulted. If that were an illness, we would consider that an epidemic. It is unacceptable that this is what's happening. We have to continue to work harder and harder, as this is an example of doing, to get that information to students about what's happening. Our students are very fortunate. We have wonderful service providers here on our campus. There are phenomenal people who provide services, and our students who have experienced assault and come to get services on campus identify those services as very supportive and helpful. We also, though, have only limited times that we can provide those services, particularly in the medical realm. Our health center hours are constrained, and so when students have sexual assault happen to them after those hours, our students are community members also, and they use the services of Bloomington Hospital, Monroe Hospital. They have the support of the law enforcement officers from the community when they're not on our campus. Having this strong safety net of everyone working together to provide better and better services, as well as this tremendous educational opportunity for our students, is a wonderful opportunity for all of us to work more actively to make this an issue that none of us lets continue to be a hidden epidemic any longer. Thank you.
Thank you. And now Toby Strout, Executive Director from Middleway House.
Thank you, Chris. In case the need for this set of responses isn't immediately apparent, perhaps the following statistics will make it plain. In all of 2008, Middleway House advocates made 40 visits to the hospital to deal with victims of violence against women. In 2009, just through the end of July, we made 51 visits. In 2008, Middleway House advocates worked with 73 sexual violence survivors. Since July 31st, we have worked with 73 survivors of sexual violence. 2009 is stacking up as a year of great need. Middleway House started the Rape Crisis Center in 1988 at the request of the city and the university. In 1992, we started on-scene advocacy, both of which positioned us to be available 24 hours a day, 365 days a year. Middleway House is specifically dedicated to the realization of the full potential of women and girls. And we know that violence against them and the threat of violence against them often robs them of the spirit that it takes to realize that potential, and it deprives the community of their gifts. We welcome this opportunity to work with the prosecutor and all the other agencies who are present here and some who are not, to provide what social science research tells us over and over again is the single best predictor that a victim of violence will heal and go on to lead a productive life. And that is early contact with a victim advocate. Thank you all.
Debbie Malone from Indiana University Sexual Assault Crisis Services.
Thank you, Chris. It's very heartening to see so many people come out today to witness the announcement of this initiative. It's also very heartening to know that all of us who work day to day in the area of sexual assault, both providing services to survivors of sexual assault as well as working toward preventing it from occurring in the first place, that we now, even though we've always worked together, that now we have this structure and format that's going to allow us to really respond in the best way possible for the lives of victims and survivors in our community. This week we're welcoming new students and returning students, and we on campus and in the community already are active in providing the message of consent, and this poster will just add further support for that message. So thank you all for being here, and thanks to all the other groups that will continue to work together to improve the lives of students and community members here in Bloomington. Thanks.
And our last speaker is Captain Joe Qualters from the Bloomington Police Department.
Thank you, Chris. Good morning. Law enforcement being involved in sexual assault investigations or rape investigations is nothing new. What this program does is essentially formalizes the coordinated effort of all of the parties involved in a sexual assault investigation: law enforcement, medical personnel, the prosecutor, and the various support services. Our department participates in a crisis intervention team model in dealing with the mentally ill. A recent review of that program has shown that the enhanced communication between all of the parties dealing with that has been a major benefit between the medical personnel, the law enforcement officers, as well as the family of those who are dealing with mentally ill family members. This program will work in much the same way, in that it will enhance that communication aspect among all of the people involved. We will be aware of what all the objectives are for the respective parties, and that they will all take an active role in putting this case together for prosecution. Again, this team approach should also enhance the overall quality of the cases being put together and sent to the prosecutor's office for review, and it is our hope that this will lead to more individuals being held responsible through the criminal justice system. Over the last 3 years, the Bloomington Police Department has averaged 70 reports of sexual assault or rape. Unfortunately, those statistics are pretty consistent from year to year. That's over 200 women who felt that they were the victim of forced, unwanted, or unexpected sexual activity and reported it to law enforcement. And that's only the reported cases. As we all know, there are many cases that go unreported for a variety of reasons, such as shame, embarrassment, or fear. That's too many. From the law enforcement perspective, the education component of this program is just as critical as the investigation protocol. We fully support the effort to reduce the number of victims of these types of crimes. Mr. Gall is to be commended for his work on this program. We look forward to the upcoming training and the benefits that this program will bring about. Thank you.
I would ask all our speakers to please come forward for questions. Are there any media that wish to ask questions at this time?
We will try to get as many involved as possible. I know that we've had sign-ups already. I know that I've required, I supervise the detective division. At this point, all of my personnel will be attending, and we'll obviously advocate more. Keeping in mind that most of these types of cases are in fact investigated by detectives who have some certain expertise in this area already. So we will try to get as many involved as possible, but at minimum, detectives are the first ones up to bat.
I can follow up on that. We have over 60 people already registered for this training, and that includes not only Bloomington Police Department, but Indiana State Police Post, IUPD, and the Sheriff's Department. Any other questions from media? Okay. If not, then thank you very much for your attention to this, and be looking for the poster around town. Thank you.